more than medicine. That's the phrase I chose for the title of my presentation because what I've learned through my research and experience is that healing, especially for children with cancer, often means more than just curing. In many parts of the world, especially in low-resource settings like Tanzania, children with cancer may never access curative treatment at all, but that doesn't mean care ends. In fact, it's where a different kind of care begins, palliative care. Today, I'll be sharing the work I've done exploring how palliative chemotherapy is being used in Tanzania, not just to extend life, but to relieve suffering, uphold dignity, and support families during some of its hardest moments. But first, a little more information about me. My name is Everett Sutton, and I'm a rising junior at Durham Academy in Durham, North Carolina. I've always been passionate about equity and fairness, especially when it comes to opportunity, whether in healthcare, education, and justice. I believe every child, no matter where they're born, deserves a chance at a dignified life and compassionate care. That belief is what has guided much of the work I've done so far. I've worked as a research associate with Duke Pediatric Oncology, focusing on palliative chemotherapy for children at the Bugando Medical Center in Tanzania. I've also volunteered with the Duke Innocence Project, where I've fought to free innocent men off death row. I'm a Borlaug Scholar through the World Food Prize Foundation and a co-author on an abstract with the African Organization for Research and Training in Cancer. At school, I serve on the Student Academic Committee, help lead Aging Autism, and compete on our varsity soccer and tennis teams. I also love backcountry skiing whenever I can. Across everything I do, I'm driven by one big idea. How can we build a world where everyone has a fair shot, no matter their geography, background, or circumstances? But now, let's go back to palliative care and how it relates to global health. Global health is not just the field about epidemiology or global diseases, but also about equal and fair treatment around the world. Children with cancer in low and middle income countries like Tanzania often lack access to essential palliative care services. But these are actually the countries that need these services the most. In countries like Tanzania, there's a stigma around cancer, where there are a couple misconceptions. First being that cancer is not only incurable, but also that it's not present in children. This leads to many parents ignoring early cancer warnings and signs and not providing the proper treatment to their children. This leads to, when cases are actually brought to hospitals, the cancer is too far advanced to be cured. That's when palliative care would be used, but there is not an adequate amount of resources. In fact, over 90% of children with cancer in these countries die without access to the adequate pain relief or psychological support. This rate is so much higher than in countries like the US or other countries in Europe, which have more resources. Think about it. When a child has cancer that is far too advanced and cannot be cured, they deserve the right for their pain and suffering to be lessened with palliative care, but they don't have it. This is a global health issue that needs to be solved. So, for my research, what did I do? Well, let's first look at what palliative care actually is. Palliative care, again, is used instead of curative treatment. And the most common form of palliative care is oral chemotherapy. This is the most common type in Tanzania. It is used because it has very low toxicity and is also extremely cost-effective for the hospital. The purpose of my research was to evaluate the effectiveness of palliative care at this hospital. I looked at which diseases are the most responsive and the average survival period once initiating palliative care. My process was, when a new patient is admitted and given to the pediatric oncology ward, that patient is then, their data, both demographic and treatment information, is entered into a patient database. I created a new specialized database with all patients in this general database that initiated palliative treatment at some point in their treatment. This database then analyzes all of the cases that have used palliative therapy and creates a certain charts and tables that we can use for later analysis. This database also auto-updates when any new patient is added to it. Here are my results. First, I studied 139 patients with an average age of 9 years. The 54% of these patients were male and 46% were female. Wow, this average survival length of these patients was 306 days. That is an extremely long time that they've survived after being considered uncurable of their cancer. That shows the importance of palliative treatment. On the right is a graph of the most common reasons for treatment initiation. This is metastases and residual disease. Then, I also looked at the average days of survival after initiating care again, but this time divided by diagnosis, so you can see which diagnoses are best impacted by the palliative treatment. On the right is again the most common diseases for these kids that have initiated palliative treatment, which shows the hospital which cases are the most likely to need palliative treatment and are the most likely to go to the stage of incurability. So, how does this research have an impact on global health? This research proves that oral chemotherapy is feasible and well tolerated. It proves that this palliative treatment has elongated the lifespan of these patients and does indeed work and is very necessary. It also gives us the information of which diseases are most impacted by palliative care and should be targeted, such as Hodgkin's lymphoma or Wilms tumor. It also shows that the integration of low-cost oral palliative regimes actually does work and should be spread across the globe. In the future, some other studies could be done to optimize the palliative care protocols and also assess quality of life outcomes, whereas my research only focuses on the longevity of life. These are my references for my information sources and images. These are my acknowledgements. And thank you so much for watching my presentation.